Welcome to Module 2, Epidemiology and Disease Surveillance. Epidemiology is often described as the cornerstone of public health. It is the study of how diseases spread, their causes, and their effects on populations. Understanding epidemiology allows public health professionals to identify health risks, track disease outbreaks, and evaluate interventions aimed at controlling or preventing diseases. This module introduces you to the principles and methods of epidemiology and disease surveillance, including how data is collected, analyzed, and used to make decisions in public health practice. Definition and scope of epidemiology. Epidemiology is the study of the distribution and determinants of health-related states or events in specific populations and the application of this study to control health problems. It involves describing who is affected by diseases, person, where and when cases occur, place and time. Investigating causes or risk factors associated with diseases. Applying findings to prevent disease and improve health outcomes. It bridges the gap between clinical medicine and public health by providing evidence to inform policies and programs. Types of epidemiological studies. Epidemiological studies are generally classified into two categories. Descriptive epidemiology focuses on characterizing the distribution of diseases by time, place, and person. Common tools include case reports, case surveys, cross-sectional studies, and surveillance data. Analytical epidemiology aims to identify and quantify the determinants or causes of disease. It includes cohort studies, follow groups over time to observe who develops the disease. Case control studies compare those with the disease cases to those without controls to identify risk factors. Experimental studies, such as randomized controlled trials to test interventions. Measures of disease frequency. Understanding disease occurrence requires quantifying how frequently diseases occur using measures like incidence, the number of new cases in a population during a specified time. Prevalence, the total number of existing cases, new and old, at a given time. Mortality rate, the number of deaths in a population during a specified period. These metrics help public health professionals prioritize health problems and allocate resources. Disease surveillance systems. Disease surveillance is the continuous, systematic collection, analysis, and interpretation of health data essential for planning, implementation, and evaluation of public health practice. Surveillance helps detect outbreaks early and monitor trends over time. Types of surveillance include passive surveillance, healthcare providers report cases voluntarily. Active surveillance, public health officials actively seek out cases. Sentinel surveillance, selected sites report all cases of specific diseases. Syndromic surveillance uses symptom patterns to detect possible outbreaks early. Outbreak investigation. When unusual increases in disease occurrence happen, public health professionals conduct outbreak investigations. The key steps include confirming the outbreak, defining and identifying cases, describing data by time, place, and person, developing hypotheses about the source and mode of transmission, testing hypotheses with analytical studies, implementing control measures, communicating findings and prevention strategies. Role of epidemiology in public health policy. Epidemiological data informs public health policy by identifying priority health issues, evaluating effectiveness of interventions, guiding resource allocation, supporting regulations and laws to protect health. Policy decisions grounded in strong epidemiological evidence have better chances of improving community health. Module 2 equips you with foundational knowledge of epidemiology and disease surveillance, critical tools for understanding and managing health threats in populations. Mastery of these concepts enables effective disease prevention, timely outbreak response, and evidence-based public health policy. By the end of this module, you should be able to define epidemiology and its scope, Differentiate between descriptive and analytical epidemiology. Understand and calculate measures of disease frequency. Explain the types and importance of disease surveillance. Describe the steps involved in outbreak investigations. Recognize how epidemiology supports public health policy. That will be it for this module. Take the quiz to continue to the next module. We'll see you on the next module.